Good day, viewers. My name is Dr. Brian Bogo, the medical officer in Western Family Hospital. Today, we will be talking about a very special topic in our health series, particularly the disease called diabetes mellitus. Now, diabetes is a word that goes around, and I'm sure you're wondering, what is this disease? What are its symptoms? How is it tested for, and how do you manage it? Well, these are the questions we're going to answer today in our videos. So let's start with what is diabetes mellitus. Diabetes is a metabolic disease whereby you have very high blood sugars found in your blood. The reason for this is because, particularly, this hormone called insulin in your body is not working appropriately. Now, we do have two types of diabetes known worldwide, type 1 and type 2. But for the sake of this video, let us focus on type 2 diabetes that is very common and prevalent in our country. So type 2 diabetes, as I said, is caused by poor insulin function in your body. Sometimes it's related to whether the insulin is not acting properly with some certain tissues or organs, which leaves you to have very high levels of sugars in your blood. Now, those are the causes for the disease. What about the symptoms? There are a variety of symptoms that come about with diabetes mellitus, but let us focus on three main symptoms. To start with, one called polyphagia. Polyphagia essentially just means the need to eat more in the day, and more specifically, sweet or sugary foods. The reason why people do this, or when you do this when you have the disease, is because there's so much sugar in your blood, but it's not going to the organs that require it. So your body immediately thinks that you are starving. And because of that, you tend to eat more in the day. Symptom number 2, that's very common, is called polydipsia. Polydipsia essentially just means the need or the urge to drink water in the day. The body knows that very elevated sugar levels in blood is quite dangerous. So the best way to deal with this is to dilute it by drinking lots more water in the day. And finally, symptom number 3, polyuria. In this term essentially means the need or the increased frequency of urinating in the day. The reason for this is because the body is trying to eliminate as much glucose and sugar from the body as possible. And the best way to do this is through the kidneys. And as we all know, the kidneys generate urine. So the body tells the kidneys to produce so much urine that you tend to go more times in the day than you usually do. Now, those are the three main symptoms that we as medical personnel look out for when a patient is suspected to have diabetes. There are lots of other symptoms that come about in the same disease. For example, maybe lethargy, that's when you feel the lack of motivation. There's also symptoms of nausea, you feel like vomiting often, and generally you feel like you don't have energy. And those are the symptoms that come with it, and that's how we find out about the disease. So, I have come to the end of this first session of the video. Stay tuned for the next video where we'll talk about how it is diagnosed and how we manage it. Thank you for your time and enjoy your day.